Today we'll be doing the cardiovascular physical exam. This is a video for the University of Dayton Physician Assistant Program. We'll be starting the exam with the head, ears, eyes, nose, and throat. And initially what I'm going to do is get my light and take a look at my patient. I'm going to have you close your eyes. I'm taking a look at the eyelids for the xanthomas or xanthomata. Those are those small cholesterol deposits that can form on the eyelids. I'm going to have you look up toward the ceiling. I'm just going to pull your eyelids down. I'm looking for any hemorrhages that might show up on the conjunctiva. At this point, you would also do a fundoscopic exam in each eye, looking for a hypertensive retinopathy and Roth spots. Now I'm going to have you lay back, if you would, on the bed, and I'm going to pull this out. Are you comfortable there? Mm-hmm. Okay, and I'll raise you up a little bit. At this point, we're going to ask the patient to open the gown to let us see the chest wall. I'm also going to have my tangential light. Initially, I'm going to look for any deformities or any scarring that might be there. And then I'm going to inspect each of the 5 regions. In this, I'm going to use tangential light so I can see any lifts, which are those subtle changes in height or small pulsations you may see on the chest wall. So the first location is the aortic region. This is the second intercostal space at the right upper sternal border. Then we're going to look at the pulmonic region. This is just on the other side of the sternum at the left sternal border. Erb's point, which is your third intercostal space. Tricuspid region, which is your 4th intercostal space. And mitral, which is the 5th intercostal space at the mid-clavicular line. You also will observe the point of maximal impulse, or PMI, which is usually just lateral to the mitral region. The next step then would be to palpate. We're going to palpate all those same areas for thrills or heaves. Heaves would just be a pulsation you would feel on your fingertips. A thrill is more of a vibration that you feel. It's actually a manifestation of a heart murmur that is strong enough that you can feel it on the chest wall. So the same places, the aortic, pulmonic, Erb's, tricuspid, mitral, and then I'm also going to see if I can feel the PMI. Quite often you can feel the PMI in a healthy patient. It's not necessarily a sign of any disease unless it's displaced. The next step is auscultation, and we will auscultate in each of the same 5 regions. We'll use both the bell and the diaphragm to hear both high and low heart sounds. Now your stethoscopes all have the tunable diaphragms, and so you do not have to switch sides in order to hear both the bell and the diaphragm. You can do that just by changing pressure of your stethoscope. However, during the checkoff, you do need to verbalize that you are listening with both the bell and the diaphragm, because whoever's watching you will not be able to tell that just by looking at you. So I'm going to listen with both the bell and the diaphragm, and I'll listen in the aortic region, in the pulmonic, Erb's point, tricuspid, and mitral. The next step is to augment mitral stenosis. That's just to help enhance the sound a little bit more. I'm going to have you roll over on your left side, if you would, please. And then I'm going to listen with the bell in the mitral region, and that should enhance any murmur of mitral stenosis. All right, you can lay back on your back if you'd like. The next test we'll be doing is jugular venous pressure, and this is looking at the pressure in the jugular veins in the neck and seeing if it may be elevated in conditions such as heart failure. So the first landmark I need to find is the angle of Louis, or the sternal angle. It's right about at that second intercostal space, and that's where I'm going to place my ruler. I'm also going to look at my patient's neck for the jugular vein, looking at how high the pulsations come up. So I will take and place my ruler on the angle of Louis. I'll then take my straight edge, line them up with the pulsations, and wherever it falls on that ruler is how many centimeters the jugular venous pressure is. Now when you do this for your checkoff, you'll be doing it on the side that faces yourself. I just did that on the opposite side so that you'd be able to see what we're doing. And again, we'll practice that in class a little bit more. The next test is called the hepatojugular reflex. We're looking for any reflux of the blood up into the jugular veins. And so you're looking at that same pulsation in the neck. This time you're going to take and apply pressure in the right upper quadrant. And so you'll just take and apply pressure. You'll watch to see if that pulsation increases or raises up. In real life, you'd hold this for 30 seconds. For the purposes of the checkoff, you just need to verbalize that you would hold it for 30 seconds. So now we'll have our patient sit back up. We'll auscultate again with the patient sitting up because the heart sounds can be slightly different with the patient sitting up. So we'll listen in those same 5 regions again with the bell and the diaphragm. So aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. Then I'm going to augment aortic regurgitation. So this time I'm going to listen with my stethoscope in the pulmonic area. If you would lean forward, and I'm going to have you blow your air all the way out and then hold it. All right, and you can breathe again. And that would just increase the sound if the patient had aortic regurgitation. Now we'll move on to the peripheral vascular system. The first thing is looking at the neck, looking to see any pulsations, any distension of the veins. We're going to palpate some vessels in this area. The first vessels are the temporal arteries. These you can do together. The carotid arteries are next. These you should not palpate together because you will do something called carotid massage that we actually use to reset certain arrhythmias and actually can cause the patient to pass out. So one at a time, we'll palpate the carotid arteries. Okay. Then I'm going to auscultate those same arteries. This time I'm going to use my bell, but I'm also going to switch the stethoscope to the smaller diaphragm just because we're listening in smaller areas. So for temples, we just need to listen. We're listening for any bruit. And the patient can breathe normal for this. All right. Now for the carotid, I'm going to have you take a breath in and hold it. Okay, and you can breathe. And take a breath in and hold it. And you can breathe. The reason the patient holds their breath for that part of the exam is the fact that we don't want to hear the breathing and confuse it with the sound of a bruit. Next, what we'll do is go ahead and inspect the upper extremities. We're looking at the arms for the color. We're looking for any hair loss. I'm going to look at your nails for any splinter hemorrhages that might be there, any discoloration. I'm going to palpate for temperature and texture. I'm also going to palpate for capillary refill as well. And then I'm going to check some pulses. The first pulse is going to be the brachial pulse. That's going to be just above the antecubital fossa. And you'll do that on each side. And then I'm going to do the radial and ulnar pulses. Those you can do both at the same time. So we'll do both radial pulses and both ulnar pulses. All right. The next test is called the Allen test. This is a test that we would do before obtaining an arterial blood draw. The purpose of this is to check the collateral circulation in the hand and make sure that they do have full collateral circulation before we go and remove some arterial blood. So in order to do this, what I'm going to do is I'm going to have my patient make a fist. I'm going to squeeze both the radial and ulnar arteries. Go ahead and open your hand. I'm going to hold that. You can see his hand is blanched. I'm going to let go of the ulnar artery and watch the color return. Okay, go ahead and squeeze again. Again, I'm going to occlude both. Go ahead and open. This time I'm going to release the radial artery and see that again the color comes back. And we'll do that on both hands. Go ahead and make a fist. I'll occlude, open. I'll release the radial this time. The color's returned. Go ahead and squeeze. And I'll occlude. Go ahead and open. And now I'll release the ulnar and watch the color come back. So that's a specialized test you would do before you draw arterial blood gases or another arterial blood draw. The next test is called the Adson test. This is a test for any change in circulation because of thoracic outlet syndrome. So to do this, I'm going to take and I'm going to feel my patient's radial pulse, but I'm going to actually position my hand underneath, and you'll see why in a minute. So I'm going to find his radial pulse. Now what I'm going to have you do is I'm going to raise your arm. I'm going to have you turn your head toward me, lift up your chin, and take a breath in. Okay, and you can breathe. Now, a positive test would be that the pulse strength would diminish during that maneuver. A normal test is that it continues to be the same. And we'll do the same thing on this side. Okay, turn your head toward me, take a breath in. Okay, you can relax. The next part of the exam is inspecting the lower extremities. We're going to look for the color. We're looking for any swelling or hair loss. We also will look for ulcers. You can look for splinter hemorrhages in the toenails as well. They can show up there. We're going to palpate for temperature and texture, and then we'll do pitting edema. With pitting edema, we're going to start at the lower ankle right over the tibial spine and see 3 locations along the tibial spine. I'm also going to press firmly behind the heel and on the dorsum of the foot. And if there was any pitting edema, you would see that your thumbprint impression would be left there. So we'll do the same thing on the other side. You also would do your capillary refill. We will also check posterior tibial and dorsalis pedis pulses as part of this exam. All right. And for the last part of the exam, I'm going to have my patient lay back down. So I'll have you lay down if you would. That out. And you'll notice that I'm laying him fully supine for this. All right, I'm going to have you rest your arms down by your side. So I'm going to inspect that aorta for any pulsations to see if there's any obvious pulsations there. I'm going to palpate the aorta just to make sure it's not enlarged. And then we're going to go back and auscultate. The regions that we're going to be auscultating are the aorta, the renal arteries, and the iliac arteries. So we'll listen for any bruit at the aorta. The iliac are above the belly button on either side. I'm sorry, those are the renal. The iliac are just below the belly button on either side. All right. And then for pulses, I will be palpating the femoral pulse. For our purposes, with the checkoff, you will be checking above clothing on your partner. So you just find the fold or the crease, the inguinal crease, and palpate. And then for popliteal pulses, I'm going to have you bend your leg. And the pulse is up kind of underneath inside there. It can be difficult to feel on many patients. Okay. And then I'll have you bend this leg also. And that concludes our exam of the cardiovascular system.